All right. So we will get started now. Okay, welcome everyone. Thank you for joining.
Maligayang pagdating sa inyong lahat. Salamat sa pagsali.
I am Yarelis Estrada from the New York City Department of Health and Mental Hygiene, and we're co-hosting with the Endangered Language Alliance for this evening's event.
Ako si Yarelis Estrada mula sa New York City Department of Health and Mental Hygiene at makikipagsama kami sa Endangered Language Alliance at sa Red de Pueblos Translaciones para sa community conversation ng COVID-19 vaccine.
This webinar is part of a series of webinars with many community interpreters for a variety of Indigenous languages.
Ang webinar na ito ay bahagi ng isang serye ng mga webinar na may maraming mga tagapagsalin ng komunidad para sa iba't ibang mga katutubong wika.
This evening, we will have live interpretation to Tagalog, and in future community conversations, we will have other languages.
Ngayong gabi ay magkakaroon kami ng live na interpretation sa Tagalog at sa hinaharap na pag-uusap sa komunidad, magkakaroon kami ng iba pang mga wika.
We are excited to bring you all together to discuss the critical issue of the COVID-19 vaccines.
Nasasabik kami, pagsamahin kaming lahat upang talakayin at ang kritikal na issue ng mga bakuna sa COVID-19.
I know we all have a lot of questions, and hopefully we will have the opportunity to speak about many of your concerns today.
Alam kong lahat tayo ay may maraming mga katanungan at sana magkaroon tayo ng pagkakataong magsalita tungkol sa marami sa inyong mga alalahanin ngayon.
That way, everyone can make an informed decision about the vaccines.
Sa ganung paraan, ang bawat isa ay maaaring makagawa ng isang kaalamang desisyon tungkol sa mga bakuna.
I would like to introduce you to our Tagalog interpreters and community leaders, Eden Lagado and Abigail Santos.
Nais kong ipakilala sa inyo ang aming Tagalog interpreter at pinuno ng komunidad, si Eden Lagado at Abigail Santos.
They will introduce themselves in English and in their native language, Tagalog.
Ipapakita ang mga ito sa Ingles at sa kanilang katutubong wika, Tagalog. Ako po si Abigail Santos. Ako po ay laki sa lugar ng maliit na isla ng Saipan. Pero po ang mga magulang ko ay laking Pilipinas. Kami po ay nakipagsapalaran dito sa New York ng 2002 nung ako ay 12 years old pa lang. Ngayon po ay ako ay isang nurse sa Flushing Hospital bilang labor and delivery nurse. At kinagagalak ko po kayong makilala at makatulong sa araw na ito.
Hi, ako naman si Eden Lagado, isang ina ng 3 bata, katutubong Pilipino na naninirahan ngayon sa Queens, New York.
Thank you, Eden and Abigail.
Hi, welcome.
Salamat, Eden at Abigail.
We acknowledge that this past year has been especially stressful and painful.
Kinikilala namin na ang nakaraang taon ay lalo na nakaka-stress at masakit.
The loss of loved ones, jobs, businesses, homes, and livelihoods has been an enormous weight for us all.
Ang pagkawala ng mga mahal sa buhay, trabaho, negosyo, bahay at kabuhayan ay naging isang napakalaking bigat para sa ating lahat.
Many of you have also suffered from years of disinvestment, biased treatment, and lack of access.
Marami sa inyo ay nagdusa din mula sa mga taon ng disinvestment, kampi ng paggamot at kawalan ng pag-access.
These experiences have reinforced cycles of trauma and created a lack of trust towards government and healthcare.
Ang mga karanasang ito ay nagpatibay sa mga siklo ng trauma at lumikha ng kawalan ng tiwala sa gobyerno at pangangailaga sa kalusugan.
We empathize with those who have historically or personally experienced discriminatory treatment.
Nakikiramay kami sa mga nakaranas ng kasaysayan or personal na diskriminasyon.
The work that we're doing to educate and gather information for the community on vaccination is keeping these important truths in mind.
Ang gawaing ginagawa namin upang turuan at makalikom ng impormasyon mula sa pamamayan sa pagbabakuna ay nasa isip ang mahahalagang katotohanan ito.
We're not here to convince or force anyone to get the vaccines, but we want to provide all community members with the most up-to-date scientific information so everyone can make an informed decision about their bodies.
Hindi kami narito upang kumbinsihin o pilitin ang sinuman kung kumuha ng mga bakuna. Ngunit nais naming ibigay sa lahat ng mga kasapi ng komunidad ang pinakahanggang sa ngayon na impormasyon pang-aham upang ang bawat isa ay makagawa ng isang may kaalamang desisyon tungkol sa kanilang katawan.
I want to set and share some community agreements to ensure a productive conversation when we have the discussion.
Nais kong magtakda at magbahagi ng ilang mga kasunduan sa komunidad upang matiyak ang isang produktibong pag-uusap.
First is respect everyone's opinions and concerns.
Una, igalang ang mga opinyon at alalahanin ng lahat. Balido ang karanasan ng bawat isa.
Everyone's experience is valid, and we want to respect everyone's concerns tonight.
Nais naming igalang ang mga alalahanin ng lahat ngayong gabi. Ang lahat ng karanasan ay balido.
And the second is please speak one person at a time and do not interrupt anyone.
Pangalawa, mangyaring makipag-usap ng isang tao ng paisa-isa at huwag mangambala sa sinuman.
Everyone will be on silent, so raise your hand if you have a question.
Tatahimik ang lahat, kaya itaas ang inyong mga kamay.
Everyone can also put their questions in the chat.
Maaari ring ilagay ng lahat ang kanilang mga katanungan sa chat.
If you're watching from Facebook Live, you can share your questions in the comments of the video.
Kung nanonood mula sa Facebook Live, maaari mong ibahagi ang iyong mga katanungan sa komento ng video.
Today, we want to share with you what we know about the vaccine and answer any questions that you might have.
Ngayon, nais naming ibahagi sa inyo ang alam namin tungkol sa bakuna at sagutin ang anumang mga katanungan na mayroon kayo.
I want to introduce you to Angela Soto, Director of Health Promotion for the Department of Health, who will present on many topics, including the safety and access to vaccines.
So, nais naming ipakilala sa inyo si Angela Soto, Direktor ng Kalusugang Pangtulong para sa Kagawaran ng Kalusugan, na magpapakita ng maraming mga paksa kabilang ang kaligtasan at pag-access sa mga bakuna.
We also have Dr. Flores, a doctor from Health and Hospitals, here with us today.
Nandito rin si Dr. Flores, isang doktor mula sa Health and Hospitals, kasama natin ngayon.
Everyone here is here to answer your questions.
Nandito kaming lahat upang sagutin ang inyong mga katanungan.
And with that, I'll pass it on to Angela to start the presentation. Thank you.
Sa pamamagitan nito, ipapasa ko ito kay Angela upang simulan ang presentasyon. Salamat.
Great, thank you, Yerelis, and thank you everyone for this opportunity to be here with you tonight. So I will begin by thanking you and really offering us this opportunity to share very critical information about COVID-19 vaccines.
Magsisimula na po tayo tungkol sa mga importanteng impormasyon tungkol sa COVID-19 vaccines.
We're in an important moment in the COVID-19 public health emergency response, and we are committed to making sure that all New Yorkers have the information they need to make informed decisions about COVID-19 vaccines and getting vaccinated.
Nandito ho kami para mag-provide ng impormasyon tungkol sa bakuna at para ibigay lahat ng impormasyon ng inyong kinakailangan.
We regularly update our guidance based on what we learn.
Regular po naming ina-update lahat po ng aming impormasyon base po sa aming inaaral.
And base that information on the current state of COVID-19 transmission throughout New York City. The most important part is that we want our communities as informed as possible.
At binabase ho namin tong impormasyon na to tungkol ho, base ho sa mga impormasyon na aming makukuha sa mga resulta ng bakuna at COVID-19.
I will share some key messages about the vaccine.
Ipapahiwatig ko po ang mga importanteng mensahe tungkol sa COVID-19 vaccines.
I will start by saying that the vaccines save lives.
Ang mga bakuna ay nakakasagip ng buhay.
How? They develop immunity or protection from a disease, in this case, COVID-19. And it allows our bodies to defend ourselves against the disease if exposed.
Ano ho? At ang bakuna ay nagkakaroon ho ng proteksyon mula sa virus at para ho maprotektahan tayo.
The other important key message to understand and to know is that the COVID-19 vaccines are safe and effective.
At ang isa pa pong pinaka-importante na inyong malaman ay ang bakuna ay ligtas at mabisa.
It is important to know that the COVID-19 vaccines are at no cost to anyone, especially now that we've opened up access to everyone, whether they live in New York City or not.
At gusto ho naming ipaalam sa inyo na ang bakunang ito ay ibinibigay ng walang gastos sa lahat po ng lokasyon na pwede kayong magpabakuna.
It is important to know that the COVID-19 vaccines are available to all people, regardless of immigration status, and the vaccine is not a public charge.
Ang mga bakuna sa COVID-19 ay magagamit sa mga tao sa lahat ng mga katayuan sa imigrasyon at ang pagbabakuna ay hindi isang pampublikong benepisyo sa ilalim ng panuntunan ng singgil ng publiko.
It is also important to know that when you share your information with us, your privacy is protected.
At gusto ho naming malaman nyo na importante ho na kapag nagpabakuna ang mga tao, mapoprotektahan ang kanilang privacy.
And as we continue to learn more and more about the vaccines, we will provide our community members with facts and information so that you can make an informed decision about the vaccine.
At gusto ho namin na malaman nyo na kapag nag-update ho ang mga information ay sasabihan ho namin kayo para makapag-desisyon po kayo ng tama tungkol sa bakuna.
We will assure transparency about the COVID-19 vaccines, how they were developed, the monitoring that takes place, how they work, and what you should expect when you receive your COVID-19 vaccine.
At ipapaalam ho namin kung paano to ginawa at kung ano po ang dapat na expectation nyo tungkol sa bakuna.
So let's talk about what vaccines are currently available in the United States and specifically in New York City.
Ngayon po ay pag-uusapan natin ang mga bakuna para sa COVID-19 dito sa US at sa New York City.
There are 3 vaccines that have been authorized by the Food and Drug Administration.
Meron hong 3 bakuna ang pinapahintulutan ng FDA para magamit at kasalukuyang nagagamit sa New York.
The 2 vaccines that were given the emergency use authorization early on are the Pfizer vaccine and the Moderna vaccine.
Ang dalawang bakuna na naibigay na nung emergency dito ay yung bakunang Pfizer at yung bakunang Moderna.
Both of these vaccines share a very similar technology known as messenger RNA technology.
At itong dalawang bakuna na to ay parehas sa pagbisa dahil parehas ho silang gumagamit ng mRNA.
And both of these vaccines, the Pfizer and the Moderna, require 2 doses.
At parehas ho silang nangangailangan ng 2 dosis.
The Johnson & Johnson vaccine, also known as Janssen vaccine, has a different platform.
Ang pangatlong bakuna ay ang Johnson & Johnson, nangangalan ding Janssen, pero ito ay mas iba kumpara sa dalawa.
The platform that Johnson & Johnson uses is something we're most familiar with in terms of it's used in other vaccines, and it's the adenovirus vector vaccine or adenovirus vector technology.
Ang Johnson & Johnson na bakuna ay mas pamilyar sa kagamitan natin. Ito ay gumagamit ng adenovirus vector.
And as you know, and if you haven't heard already, the Johnson & Johnson or Janssen vaccine is a 1-dose vaccine, one and done.
Ang bakunang Johnson & Johnson o Janssen ay nangangailangan ng 1 dosis lamang kumpara dun sa 2.
There are other vaccines that are still being tested in clinical trials, and we will let our community members know where they are in the process or when they will be approved in the United States, the more we learn about them.
Meron pa hong mga bakuna na pinag-aaralan sa ngayon at pag sila ay na-aprobahan na at pwede nang magamit ay i-update ho namin kayo.
And there are some things that we are still learning about the vaccines.
At may mga kailangan pa ho tayong kailangan malaman at pinag-aaralan.
But let me begin by sharing what we do know and we are certain about.
Pero gusto ko hong ipaalam sa inyo ang alam na natin at sigurado kami.
Sure, thank you. We know that the vaccines save lives.
Alam natin na ang bakuna ay nakakaligtas ng buhay.
We know that the COVID-19 vaccines have reduced hospitalizations.
Alam natin na ang bakuna ay nakakabawas ng pag-ospital.
We know that the COVID-19 vaccines have reduced the severity of an infection or an illness related to COVID-19.
At alam din natin na ang bakuna ay nakakabawas ng infeksyon o ng pagkalala ng apekto ng virus.
And we know that the COVID-19 vaccines have reduced mortality or death related to COVID-19.
At alam din natin na ang bakuna ay nakapagpabawas ng karamihang pagkamatay ng tao.
So now let's talk about what we are still learning about the COVID-19 vaccines.
Ngayon, pag-usapan natin ang hindi pa namin alam tungkol sa bakuna na COVID-19.
We are still learning how long the protection or how long the immunity will last after we receive a COVID-19 vaccine.
Sa ngayon ay pinag-aaralan pa rin natin kung gaano katagal ang proteksyon mula sa bakuna or kung gaano sila katagal magpoprotekta sa ating sistema.
But we are seeing great promise based on clinical trials and based on what we're seeing population at the population-wide level.
Ngunit nakakakita tayo ng improvement at ng pangako sa future ng bakuna nito.
We still need to learn what additional doses will be needed in the future.
Kailangan pa rin nating malaman kung ang karagdagan ng mga dosis ay kakailanganin sa hinaharap.
And even though we have so much more data in our hands to study, we are still learning a bit more of whether vaccination prevents people from spreading the virus to other people.
At kahit na madami na tayong impormasyon, kailangan pa rin nating malaman kung ang pagbabakuna ay pumipigil sa pagkalat ng virus sa ibang tao.
And the more of us that get vaccinated, the more we learn about this important life-saving vaccine.
At sa mas maraming taong nagpapabakuna, mas marami tayong malalaman tungkol sa pagsagip ng buhay nitong bakuna na ito.
And we need to celebrate the good news as well.
At kailangan din nating ipagdiwang ang magandang impormasyon.
There's a growing body of evidence that suggests that fully vaccinated people are less likely to transmit the virus SARS-CoV-2 to others.
Merong lumalaking ebidensya na nagpapahiwatig na ang mga taong kompletong nabakunahan ay potensyal na mas di makahawa ng COVID-19 sa iba.
That is something to celebrate and something to
Ito-
share. Yeah.
Ito ay isang bagay na dapat nating ipagdiwang.
And to share with our community members that the more of us that get vaccinated, the closer we will come to putting a stop to the transmission of this virus, SARS-CoV-2, also known as COVID-19.
At dapat natin ipakalat at ipagsabi na ang mga taong nagpabakuna or magpapabakuna ay ang visa para mapatapos ang virus ng COVID-19.
Perfect. So now let's talk about the benefits.
Ngayon pag-usapan natin ang pakinabang ng bakuna laban sa COVID-19.
It is completely normal to feel nervous about a new vaccine.
Normal na makaramdam kayo ng nerbiyos tungkol sa bakuna o di pagkakasigurado.
But we are seeing that the COVID-19 vaccine is safe and effective, and not only has benefits for the person who receives the vaccine, but for our loved ones that surround us, our community, New York City, and the world.
Pero merong matibay na katibayan na ang mga bakuna ay ligtas at epektibo at pinoprotektahan ka mula sa matinding sakit ng COVID-19 na maaaring magkaroon ng seryosong kahitnan at ng kalusugan.
So why should we get vaccinated?
So bakit ba tayo dapat magpabakuna?
For starters, it protects you from COVID-19, no matter your age, no matter your underlying conditions.
Unang-una ay itong bakuna na to ay pinoprotektahan ka ng walang kaalam sa iyong edad.
Even if you had COVID-19 and even you had COVID-19 infection, it is very important to still be vaccinated because it will lower the risk of getting it again.
Kahit na ikaw ay nagka-COVID-19 o may COVID-19, importante pa rin na ikaw ay magpabakuna.
The second reason to get vaccinated is because it protects our loved ones that are around us and those around us in a broader sense in our communities.
Ang pangalawang rason ay dahil maaari mong protektahan ang mga tao sa paligid mo at sa iyong komunidad.
And more importantly, it protects those individuals that for whatever reason cannot get the vaccine or are at a very high risk of complications if they are infected with the COVID-19 infection.
Pinaka-importante ay pag ikaw ay nagpabakuna, pinoprotektahan mo rin ang mga taong hindi pwedeng magpabakuna dahil sa kung anumang rason o dahil sa kanilang mga sakit na hindi sila qualified para magpabakuna.
And as mentioned already, this vaccine is one more tool that we have as a preventive measure to get us closer to ending this public health emergency.
At uulitin natin na itong bakuna na to ay importante dahil ito ang susi para matigil na ang COVID-19 virus.
So who can get vaccinated?
So sino ang pwedeng magpabakuna?
This slide is a little outdated because as of May 10th, individuals starting at the age of 12 can get vaccinated in this city.
Hindi ho updated tong slide na to. So gusto ho naming ipaalam sa inyo na nitong 10 ng Mayo ay pwede na hong magpabakuna ang 12 anyos.
All people starting at the age of 12 can get vaccinated at no cost. And there are many locations that allow walk-ins without an appointment.
Lahat ho ng taong edad 12 anyos pataas ay pwede na hong magpabakuna ng walang halaga. Ito ho ay libre at pwede na ho po kayong pumunta sa maraming iba-ibang lokasyon kahit ho wala kayong appointment.
It's important to note that the adolescents that are ages 12 and older, between 12 and 15 years of age, can receive a Pfizer vaccine.
Ang mga batang edad na 12 hanggang 15 ay pwede hong magpabakuna ng Pfizer vaccine.
And individuals ages 18 years of age and older can receive all three, Pfizer, Moderna, and Johnson & Johnson, also known as Janssen.
Pero ho, ang mga taong edad 18 pataas ay pwede hong mamili kahit sa anong tatlong bakunang pwedeng ibigay.
And please know that individuals who are 12 years of age or underage, 12 years of age to 17 years of age, must have parental consent. They must have a parent or a guardian either there with them or provide some way to give consent to the young adult who's 12 years of age to 17 years of age.
Importante hong malaman na ang mga batang 12 hanggang 16 anyos ay kailangan ho ng isang magulang o tagapag-alaga para magbigay ng pahintulot para sa pagbabakuna ng personal or ng telepono sa oras ng appointment.
Thank you. Where can you get vaccinated? There are many, many places to get vaccinated. That's something else to celebrate as well.
Yeah. Saan pwedeng magpabakuna? Maraming mga lugar na pwedeng magpabakuna.
Some people are able to get vaccinated at work. We actually have set up at places of work, vaccination points of distribution for city employees, for other private industry.
Sa trabaho, pwedeng magpabakuna. May mga ibang health workers o ibang grupo na mga tagabigay ng pangangalagang pangkalusugan na pwedeng mabigyan ng bakuna sa kanilang pinagtatrabahuhan.
The New York City Department of Health and the State Department of Health have also opened vaccine sites throughout the city at many, many locations.
Ang mga pinatatakbo ng estado at ng syudad ay nag-open ng mga bakunahan sa iba't ibang bahagi ng Limang Boro.
There we have buses that park at busy intersections to give vaccines at no cost without an appointment to our community members.
Meron tayong mga ini-open, binuksan na mga buses, mga busy na intersection para sa lahat ng mga tao.
And as of last weekend, we have begun to set up large pop-up clinics at many parks, at many New York City parks.
Noong isang linggo, tayo ay nagbukas ng mga malalaking bakunahan sa mga parke ng estado.
And it's also important to highlight that in addition to hospitals, we have expanded vaccine access to our federally qualified health centers, our big box pharmacies and local pharmacies, smaller pharmacies, including our primary care physician doctor's offices.
May mga iba't ibang healthcare pasilidad At mga parmasya, ito man ay maliit, ito man ay malaki, at pati na rin ang ating mga lokal na parmasya, ang ating mga PCP o mga doktor ay kwalipikadong magbigay ng bakuna sa mga pasyente at membro ng publiko.
And if you want to find out what vaccine are closest to you within a short walking distance, please, you can always visit our nyc.gov vaccine finder. And now you're able to sort based on what vaccine you prefer to receive.
Bumisita lamang sa nyc.gov Vaccine Finder para hanapin ang mga lugar at mga bakuna na nais nyong ibigay sa inyo at kumuha doon ng appointment.
Perfect. So here are just a quick overview of the steps.
Ito ay mga hakbang sa pagkuha ng bakuna.
Yeah. I mean, remember, I think that even though this says how to make an appointment, there are so many city sites, so many state sites that offer walk-in basis appointments that you don't need to make an appointment. Maybe the only locations where they are still asking for appointments are big box pharmacies like Walgreens, CVS, and Rite Aid.
Ito man ay makakakuha ka ng appointment, magtatakda ng appointment para sa mga malalaking parmasya lamang. Ngunit ngayon, tayo ay tumatanggap na, marami ang tumatanggap ng mga pasilidad na para magbakuna sa mga publiko.
And you can find all that information, such as is noted in step 1 of going to vaccinefinder.nyc.gov.
So makikita ang pagpapabakuna, ang mga hakbang sa nycfinder.gov.
And for those of you that are making an appointment online, you will be asked to fill out a New York State attestation form. But even that, you can also fill it out once you arrive on site to the vaccination location.
Sa mga gustong kumuha ng appointment online, kayo ay mag-fill out ng form online o pwede nyo ring filled outan ang mga impormasyon sa mga pasilidad ng bakunahan.
On the day of your appointment, just remember to bring proof of eligibility, mostly age eligibility, something that confirms that you are the age to be able to receive the vaccine, such as Johnson or all three of them, but something that verifies your age.
Sa araw ng pagpapabakuna, huwag kalilimutang magdala ng mga katibayan ukol sa iyong edad, tirahan, petsa ng kapanganakan. Maaari kayong magdala ng lisensya o mga ID na makapagpapatunay na iyong edad.
Yeah. And it's important to know that even for some of our city-run, New York City Department of Health locations, if people do not have an ID, if people don't have a photo ID, it's okay. We also accept a phone bill. We accept anything that has a name to the address. But our goal, our mission is to vaccinate our community members.
Kahit na wala kayong mga ID na picture ID, huwag kayong mag-atubili na magpunta sa mga city-run na lokasyon. Ang pwede naming tanggapin kahit phone bill, address na maaaring makapagpatunay na inyong edad at pangalan. Ang ambisyon natin ngayon ay mabakunahan ang lahat ng tao na kwalipikado.
Yeah. And one thing that I need to also highlight, and something that I learned today when I vaccinated my own child who's 14 years of age and doesn't have a photo ID, that make sure that the parent or guardian is with them, or that you give consent over the phone, excuse me, but that you also either maybe have a photo of the birth certificate or passport or a school ID, something that just verifies the young adult or the adolescent's age.
Ang aking natutunan ngayon nung binakunahan ko ang aking anak na ang parent ay dapat magbigay ng anumang katibayan sa kanyang batang anak. Ito man ay 12 years old hanggang 17 years old. Pwede siyang magbigay over the phone ng picture, litrato, ng birth certificate o school ID ng kanyang anak.
Thank you. And for those of us that are getting a Pfizer or Moderna vaccine, make sure that you get your second dose appointment before you leave the vaccination site.
Kung kayo ay kukuha ng Pfizer or Moderna, siguraduhin kumuha ng appointment para sa pangalawang dosis.
And please remember, I'm sure you know this already, but just please keep in mind that you will have to add an additional 15 minutes because those are the 15 minutes that you will be observed after you receive your vaccine. For those individuals that report having some type of allergies, you may be observed for longer, maybe 30 minutes.
So, maaring ilagay sa isip na kayo ay maaring maghintay ng additional o karagdagang 15 minutes o 15 minuto para sa inyong obserbasyon kung kayo man ay may allergy o sa mga magkakaroon ng allergy, ito ay maaring humaba pa ang inyong paghihintay para sa inyong obserbasyon.
The next slide here is just to show you what NYC.gov Vaccine Finder looks like. And if you look over here, you can select the language. Right now, I think they have about the top 13 languages that are spoken in New York City.
So, dito sa slide na ito, ipinapakita kung paano ang paghanap ng vaccine. Maaari kang pumili ng inyong wika. Maraming wika ang pwedeng pagpilian dito sa New York City.
Yeah. And please, it's also important to know that because we have greater access to many more vaccines, a lot more vaccine, for those individuals that received their first dose in one location that is too far away from their home, they can get their second dose anywhere else that is more convenient for them.
So, ngayon na tayo ay mayroon ng mga karagdagang access sa vaccine, pwede na kayong kumuha ng inyong pangalawang dosis kung saan mayroong malapit sa inyong lugar na konbinyente para sa inyo.
Perfect, thank you. So for Pfizer and Moderna, what the second dose means, or in terms of the timing that you need between the first dose and the second dose?
Ang Pfizer at Moderna sa pangalawang dosis, ang tamang oras o takda ng pagkuha ng iyong pangalawang dosis.
What's important to highlight here is that the vaccines offer some protection after the first dose, but the complete protection is really after the second dose. And more importantly, the vaccine is effective after the second dose and then after 2 weeks after receiving your second dose for the full immunity that the vaccine provides.
Ang Pfizer at Moderna ay nagbibigay ng ilang proteksyon matapos ang unang dosis. Ngunit mas protektado ka pagkatapos ng pangalawang dosis. Ang bakuna ay ganap na epektibo makalipas ang 2 linggo pagkatapos ng 2 dosis.
It's also important to note that we cannot mix vaccines. Make sure that if your first dose is Pfizer, your second dose 21 to 42 days later has to be Pfizer.
So, dapat nating malaman na kung ang unang nakuha natin ay Pfizer, ang dapat nating makuha sa pangalawang dosis ay Pfizer din, makalipas ang 21 to 42 days.
If your first dose is Moderna, your second dose has to be Moderna between 28 days to 42 days after receiving your first dose of Moderna.
So kung ang na-receive natin sa unang dosis ay Moderna, pagkatapos ng 28, 28 hanggang 42 araw, makakakuha na tayo ng pangalawang dosis na dapat ay Moderna rin.
And when you get your first dose, you will get the little card or proof of vaccination. Make sure you bring that for your second dose, so that we also, especially if you go to a different location that is not the location where you received your first dose.
So dalhin ang ating card na nakuha sa unang bakunang ibinigay sa atin. Dalhin natin ito sa ating pangalawang appointment o pangalawang dosis ng ating bakuna para malaman kung anong klase ang bakuna na ibinigay sa atin.
Thank you. After vaccination, some things to review.
Pagkatapos nating mabakunahan.
I think we've shared already throughout this presentation that getting the vaccine, the COVID-19 vaccine, getting vaccinated is the most important way to protect yourself and our communities from severe illness related to COVID-19.
Ang pagpapabakuna ay isang pinakamabisang paraan para sa proteksyon mula sa matinding pagkakasakit, pagpapaospital at kamatayan sa ating komunidad.
And we also know that as many more people get vaccinated, our recommendations continue to change, but at least for now, because we still see local transmission or high transmission in some communities, it's important to stay with the recommendations, especially if you're in large public settings where we do not know who has been vaccinated and who has not been vaccinated.
Maari nating ipagpatuloy ang ating ang rekomendasyon ayon sa pananatili na pagtigil sa bahay, lumayo sa iba pa, sa kapwa natin, magsuot ng mga pantakip sa mukha at laging maghugas ng kamay dahil sa ibang komunidad mayroon tayong mga nakikitang pagtaas ng transmission ng COVID.
Yeah, and until we have clear, as we're learning more, and the CDC is regularly giving us guidance about face coverings, when to wear them, double masking, when to wear them. Please, let's just keep to the recommendations, especially if you're in crowded public spaces, to wear your mask, wear a double, a disposable that is close to your face, and a cotton one that covers the disposable one for a tighter seal around your nose and your mouth.
Tayo'y patuloy pa rin na sumunod sa rekomendasyon ng CDC na lagi tayong magsusuot ng face mask. Lagi tayong magsusuot ng doble na pantakip sa muka, lalong-lalo na sa mga lugar na maraming tao. Magsuot ng disposable at cotton na pangtakip sa muka para sa lalong magandang hakbang sa pag-iwas at pag-transmit ng COVID.
Thank you. And as we learn more and more of our community members become or get vaccinated, we will receive more guidance on how to ease the prevention measures that we know.
Kami ay magbibigay ng mga update para sa marami pang mga patnubay at kung kailan tayo pwedeng mapadali o mapaluwag ang hakbang sa pag-iwas ng COVID-19.
Thank you. So what can we do right now? One, if you have not received your vaccine, get your vaccine tomorrow.
So ano ang ating magagawa sa ngayon? Kung hindi mo pa nare-receive ang iyong vaccine, magpabakuna bukas.
It's also important to note, just like our colleague and friend Yarelix mentioned, this month is Mental Health Awareness Month. It is important, just as important, to take care of our physical well-being and getting our vaccine, it's also important to take care of our emotional well-being.
Ngayong buwan na to ay Mental Health Month. Dapat nating pangalagaan ang ating sarili, ang ating kalusugan, pangkaisipan, maging pati ang emosyonal. Dapat tayo ay mag-ingat.
We are very lucky that New York City offers 24/7 access to professional counselors and peers that can talk to any one of us, regardless of age, regardless of immigration status, in over 200 languages, any time of the day, any time of the night. If you want to just speak to someone, please reach out by calling the number that you see on the screen, 1-888 NYC Well.
Tayo ay napakaswerte na dito sa New York City, dito sa New York, tayo ay pwedeng makipag-usap o makipag-talakayan kahit kanino, lalong-lalo na sa mga profesional. Maaari kayong tumawag sa numerong 1-888 NYC-WELL o mag-text WELL to 65173 o makipag-chat sa nyc.gov/nycwell.
And that number is 1-888-692-9355. I'll repeat it, 1-888-692-9355. That is 1-888 NYC Well.
Ang numero ay 1-888-692-9355.
Yes.
Ang NYC Well.
Yes. And then once you get vaccinated and you have the entire family vaccinated, please share it. Share it with your loved ones, share it with your family, share it with your neighbors. It is important to promote this, this life-saving event, really. So thank you for this opportunity and thank you for your time.
So dapat nating ibahagi sa lipunan na tayo ay nabakunahan. Ibahagi natin sa lahat, lalong-lalo na sa ating mga mahal sa buhay, na dapat nating i-promote o dapat nating ibahagi ang mga mahahalagang kaganapang ito sa ating buhay, na tayo ay protektado sa COVID-19.
Thank you.
Thank you so much, Angela. So now I would like to introduce Dr. Flores, and she can say a bit about herself. She will be supporting us through our questions and answer period.
Thank you so much, Yaralis, and thank you, as always, Angela, for keeping us informed and alerted to what is new and what benefits we get from the vaccine. I want to start by greeting everybody and saying, Kamusta po? I think that's how you say it, but I'm not sure. Some of
Yes po. Tama po. Correct po.
I'm supposed to speak a little bit about myself. I'm a physician. I'm a physician that's been working in administration for all my life. I am a pediatrician, so I take care of kids and adolescents.
Ako ay isang doktor. Ako ay nangangalaga sa mga bata.
And I want to say that working in a hospital and in any hospital, I realized that a significant number of Filipino nurses were affected by this pandemic disproportionately.
At gusto kong ibahagi sa inyo na bilang isang tao na nagtatrabaho sa isang ospital ay nakita ko na madaming mga Pilipinong nurse ay naapektuhan dito sa virus na ito.
Yeah, many of my colleagues.
Maraming mga nakatrabaho ko.
Especially since I think in some states up to 20% of the nurses are Filipino.
Lalo na dahil sa mga ibang states ay 20% ay Pinoy.
So I want to first thank this community for your service to us.
Unang-una ay gusto kong pasalamatan ang komunidad nyo
And let you know that this loss has been felt by all of the healthcare professionals.
at gusto kong ipaalam na itong pagkakawala sa inyo ay ramdam din namin sa professional na mundo namin.
So thank you.
Salamat.
Thank you. Today's a good day. Today's a
Ngayon
very
ay
good day.
magandang araw. Magandang araw.
Two great things happened today, I think.
Dalawa ang nangyari ngayong araw na to.
You know, we say that we're waiting for the light at the end of the tunnel with this epidemic, with this pandemic.
Hinihintay natin ng ilaw sa dulo ng tunnel nitong pandemya na ito.
And at least here in the United States, we're seeing it.
At dito sa United States ay nakikita na natin.
Because people are vaccinating against COVID-19,
Dahil sa mga taong nagpapabakuna laban sa COVID-19,
we are seeing deaths and cases come down significantly.
nakikita na natin ang mga pagkamatay at ang mga nauospital ay bumababa.
It's amazing.
Napakaganda nito.
One day, very soon, these masks are coming off.
At isang araw, itong mga mask o takip sa muka ay matatanggal din natin.
But that's only for people that are fully vaccinated.
Ngunit ito ay para lang sa mga taong nagpabakuna ng kumpleto.
The ability to be close to your family and friends,
Ang pagkakataon muli na maging malapit sa mga kaibigan at kapamilya nyo,
the ability to travel,
ang kapabilidad na makapagbiyahe,
and the ability to share your life with those that you love without worrying is almost here if you are completely vaccinated.
at ang kapabilidad na ibahagi muli ang iyong buhay sa ibang tao ay malapit na kung nagpabakuna ka.
So we still have to wear masks, as Angela told us, because there are many people that are not vaccinated or can't vaccinate.
Ngunit ngayon ay marami pa rin sa atin ang kailangan na magtakip ng muka o magsuot ng face mask dahil sa mga taong hindi pa nagpapabakuna or hindi pwedeng magpabakuna.
But we'll soon get some more information from New York State Department of Health.
Pero magkakaroon tayo sa ikinalalapit ng mga impormasyon galing sa New York Department of Health.
As they help us with the regulations we got today from the CDC, which are
As bilang tinutulungan nila tayo sa mga regulasyon na galing sa CDC at ito ay
that if you are with people that are completely vaccinated, that means 2 weeks after their last dose, you don't have to wear a mask.
na kung ikaw ay kasama ang mga taong nagpabakuna ng kumpleto at nakalipas ang 2 linggo ay hindi na kayo kailangan magsuot ng takip sa mukha or face mask.
That's great news. And it's also great news that we can also take care of our children by vaccinating them from 12 years on up.
Ito ay magandang balita at isa pang magandang balita na pwede na nating pabakunahan ang mga anak natin na 12 anyos o pataas.
Because even though younger children and younger adolescents don't get sick at the same rate as adults,
Dahil kahit na hindi nagkakasakit ang mga bata katulad ng mga matatanda at hindi kasing lubha,
they can still get sick and they bring that illness home to us and our families and communities. So I'm so happy they're going to get vaccinated.
maaari pa rin silang mag-uwi ng virus sa ating pamamahay at makahawa sa kapwa natin. At ito ay napakamasayang balita.
Thank you very much.
Maraming salamat.
I will now be ready for any questions that you want to ask.
Pwede na ho kayong magtanong ng mga inyong katanungan na gusto ho niyong masagot by Dr. Flores.
Thank you so much, Dr. Flores. And I will say if anyone has any questions for the presenter or Dr. Flores, then please share it in the chat, or you can use the raise hand function to say it verbally, or you can unmute yourself and you can ask your question.
There is a question. Go ahead.
Pwede ho niyong itaas ang inyong mga kamay o pwede niyo ho kayong mag-unmute para ho makipag-usap. Kung may mga katanungan man kayo para kay Dr. Flores or sa nag-present ng impormasyon sa inyong araw na ito.
There's a
Yeah, so
question. There's a question.
Yeah, I can read the question. So it says, what do we know about the variety that is causing so much destruction in India and spreading in Southeast Asian countries? Have the current vaccines been tested against it?
I would love to answer that question because I spend much of my time watching what happens in the world outside of the United States.
Sorry, this is the interpreter. Should I translate the question?
Yes.
Okay. So, ang katanungan ho natin ay paano ho nakakaapekto ang strain ng COVID-19 na kumakalat ngayon sa bansa ng India at kung kumakalat ho ba ito sa parte ng East Asia.
So what is happening is actually several things. It's almost
ang nangyayari ngayon ay madaming bagay.
If you compare what's happening in the United States, the progress we're having to what's happening in India and Southeast Asia, there is a common theme.
Kung ikukumpara ho natin ang nangyayari sa India at kung anong nangyari dito sa US, meron ho silang pagkakatulad.
In many of the countries in India and in Southeast Asia and in South America, we have had limited access to any kind of vaccine.
Sa maraming bansa ho tulad ng India, Southeast Asia at sa Africa, ang naging problema ho ay pagkakawala ng access sa bakuna o sa pagkukulang ng bakuna.
Yeah, the vaccines, whichever one at this point, including the AstraZeneca, some of the Chinese vaccines, and I believe some of the Russian vaccines, but most of them do prevent death.
Ang mga bakuna ngayon na naibibigay sa mga parte ng mundo na iyon, tulad ng AstraZeneca, ng bakuna sa Russia at ang mga bakuna ng China, ay nalalaman ho na nagsasanhi ng kamatayan.
So the lack...
It's sure. Sorry.
Okay. Oh, okay.
Ito ay nakakapigil sa pagkamatay ng mga tao. Yung mga vaccine na galing sa Russia na ginagamit at sa iba pang lugar na pinanggalingan ng bakuna ay nakaka-prevent o nakakapigil sa pagkamatay dahil sa COVID-19.
So the issue is vaccine access. They have no vaccine access to begin with. Very limited vaccine access in these countries.
Ang problema ho ngayon ay wala ho silang akseso sa mga bakuna dahil limitado ho ito.
Yeah. The second issue is the fact that they've opened up. There were lots of celebrations over the past month in many of these countries where there was no social distancing and no ability to isolate people that were new cases. So that's a second factor.
At ang pangalawang issue ho ay ang pagkakabukas po ng bansa nila at nagdidiwang ho sila at hindi ho na nagagampanan ang pagso-social distancing kaya ho kumakalat ang COVID-19 muli.
So opening up too fast without being able to socially isolate, as we know, is going to increase infection.
Ang pagbabukas ng bansa ng masyadong mabilis sa maikling oras ay magiging sanhi ng pagtaas ng infection sa kanilang bansa.
As to the variants, so this is now the third or fourth issue. As to the variants, yes, there's an Indian variant.
At tungkol sa mga variant, meron hong variant sa India.
However, if the vaccination rate had been significantly high, even the variant would not have been such a problem. it's all about vaccination access.
Ngunit kahit na mataas or maging mataas ang rate ng variant sa bansa nila, ang pinaka-problema pa rin ay ang akseso sa bakuna at sa limitasyon nito.
And the good news is that the rest of the world is finally sharing and finally helping in some ways. But this is the tragedy of what is going on here. Some countries are vaccinating 12-year-olds and some countries don't have enough for 80-year-olds.
At ang magandang balita ay ang mga ibang bansa ay ibinabahagi ang mga kanilang bakuna sa ibang parte ng mundo. Ngunit hindi ho magkakatugma ang mga lugar, yung iba-iba ay nagpapabakuna ng 12 anyos at yung ibang bansa ay nagpapabakuna pa lang ng mga matatanda.
Okay, thank you.
Salamat.
Thank you so much for that great question.
Mhm.
And I'll ask a question that's commonly asked and why I think some folks are hesitant to get the vaccines still.
At ngayon ay magtatanong ako ng katanungan na madalas na itinatanong at kung bakit nangangamba pa rin ng mga ibang tao kung magpapabakuna man sila.
And that question is, how did this vaccine come out so quickly if it's a new technology, and how did it get approved so quickly?
Paano lumabas itong bakuna na to ng napakabilis? At paano siya na-aprobahan agad?
That's my favorite question, believe it or not.
Yan ang paborito kong question na natatanong sa akin. Maniwala man kayo o hindi.
It's very important to understand that when you do away with a lot of bureaucracy, you get things done quicker.
Importanteng malaman yun na kapag kasali ang gobyerno, mas mabilis ma-aproba ng isang bagay.
But it's also important to know that even though you do away with bureaucracy, you must keep the standard that you keep for everything. You must have all the steps in place in order to approve a vaccine. And that is exactly what happened. All the steps were in place.
Ngunit kailangan ho nating malaman na kahit na may bureaucracia na nasasangkot dito, importante pa rin hong makasunod sa mga tamang proseso.
In the past, vaccines and medications take a long time.
Dati, nung araw, ang mga bakuna ay nagtatagal ng matagal na panahon bago maaprobahan.
Because you need a lot of cooperation and resources to make things happen quickly.
Dahil kailangan ng kooperasyon ng lahat at ng akseso sa mga kinakailangan.
And you need to try these vaccines out in many people to move this fast.
At kailangan na ma-testing itong bakuna na ito sa maraming tao para malaman kung ang epekto at kung epektibo ito.
In the case of this pandemic, which is an emergency,
sa kaso nitong pandemic ay emergency ito,
we had the resources,
meron tayo ng mga kinakailangan natin,
we had the collaboration of governments and scientific.
Nakuha din natin ang kooperasyon ng gobyerno at ng mga siyensya,
public health professionals,
ng mga profesional sa publiko.
and we had a great number of people of all ages and from many groups that we could test the vaccine in very quickly.
At marami din tayong tao na nakisali ng iba-ibang edad at galing sa mga iba-ibang grupo para mag-try ng bakuna.
So when you have all those things happening, things move fast. And there's just one other thing I want to say. Go ahead.
Kapag lahat yun ay meron kayo, pwede hong maaprobahan ng mas mabilis at mag-proceed ang proseso.
The big issue is that technology used to develop these vaccines was already being used for other things over the last 10 years.
Ang pinakamalaking parte nito ay ang teknolohikang ginamit dito ay ginagamit na sa mga ibang karanasan ng araw.
So good technology, good resources, lots of people, and a pandemic emergency allowed us to bring about these vaccines.
Ang teknolohiya at ang kooperasyon ng maraming tao ay ang nagdulot nitong pagkausad ng bakuna para dito sa pandemya.
Thank you.
Salamat.
Salamat.
Thank you. And there's another question. What is the latest information about the benefits of vaccines on long haulers, which means those who show severe side effects months after testing negative?
Okay. This is, she goes first.
I'm sorry, can you just repeat the question?
Sure. What is the latest information about the benefits of vaccines on people who previously had COVID-19 and still have side effects months after testing negative, sometimes called long haulers?
Okay. Ang bago kong katanungan ay kung ano ho ang bagong benepisyo tungkol sa bakuna sa mga taong nagkaroon na ng COVID-19 at nagkakaroon pa rin ng mga simptomas ngayon.
Long haulers are people who've had COVID and have symptoms for a very, very long time after they're not infected.
Ang mga long haulers ho, ang mga tao na nagkaroon na ho ng COVID-19 nung araw at hanggang ngayon, kahit na matagal na ho silang nagkasakit, ay nagkakaroon pa rin ng mga simptomas.
There are people to this day that still have symptoms, and they've had symptoms for the last 6 to 8 months.
Meron pa rin mga tao ngayon na nagkasakit at patuloy na nakakaranas ng simptomas nitong mga nakaraang buwan hanggang 6 hanggang 8 na buwan.
Those symptoms can be very debilitating.
At yung mga simptomas na yun ay madalas na nakakaapekto sa pang-araw-araw.
One of them is called brain fog. That means you forget and you can't concentrate very well.
Isa ho dyan ay ang brain fog, which is nahihirapan hong makatanda or hindi ho nakakapag-isip ng malinaw at makakalimutin.
Imagine being a nurse and having brain fog. You really can't go to work.
Paano ho kung kayo ho ay isang nurse at meron po kayong brain fog or hindi malinaw na pag-iisip? Paano ho kayo magtatrabaho ng maayos?
There are other symptoms like pain, muscle pain, headaches, and fatigue.
At ang iba pa pong mga simptomas ay sakit ng katawan, kahinaan ng katawan.
We cannot yet tell from the research that's been done who is going to get brain fog or long COVID.
Hindi pa ho namin malaman sa ngayon kung sino ho ang maapektuhan ng brain fog or ng mga mahabang oras na pagkaapekto nitong mga simptomas na ito.
It seems to affect younger people and it seems to affect women more than men.
Ang mga madalas na naapektuhan ay ang mga mas bata at ang mga babae kumpara sa mga lalaki.
There is some very early evidence that if someone has long haul and they get the vaccine, their symptoms seem to get better.
Meron hong ebidensya na ang mga taong nagkakaroon ng long haul ay nagiging maigi rin.
But it's not, we're not sure yet.
Pero hindi pa rin po kami sigurado.
The best way to avoid long haul, get vaccinated and don't get COVID. And remember, you can get COVID, yeah.
Ang pinakamabisang paraan ho para hindi nyo ho ito maranasan ay magpabakuna para ho hindi kayo magka-COVID.
Salamat. Thank you.
Salamat.
Salamat.
Salamat po.
Salamat to.
Thank you. So I know there's been a lot that was going on previously around Johnson & Johnson, and I wonder if you can speak to that and also the differences between the different types of vaccines that we currently are using.
Okay.
So, alam ko na madaming mga sabi-sabi tungkol sa bakunang Johnson & Johnson. Baka ho maaari niyong ibahagi sa amin kung impormasyon tungkol dito sa bakuna na to.
Okay, I'm going to go back to state that all 3 vaccines that are approved in the United States save lives at 100%.
Okay, so babalik ho tayo sa impormasyon na itong 3 bakuna na to ay nakakasagip ng buhay. 100% ho silang nakakasagip ng buhay.
For fatality. All 3 of them prevent people from going into the hospital and being severely ill.
At itong 3 bakuna na to ay nagpapa-prevent ng pagpasok sa ospital.
As Angela said before, we're not sure if they prevent all infection. That's why we wear a mask when we're around someone who's not vaccinated.
At tulad ng sabi ni Angela kanina, ay hindi ho nakakapag-protekta to sa lahat. So, kailangan pa rin ho natin magsuot ng pampakip sa mukha or ng face mask para protektado pa rin tayo.
Okay. All 3 of them teach your body how to fight COVID infection.
At itong 3 bakuna na to ay tinuturuan ng katawan natin na labanan ang infeksyon ng COVID-19.
And do not leave anything in your DNA to damage you.
At wala hong naiiwan sa DNA natin para ho makasakit sa pangangatawan.
Johnson & Johnson Janssen vaccine has had some reported cases of bad effects.
Johnson & Johnson or Janssen ay meron nga pong na-report na may mga masasamang epekto sa katawan.
This vaccine was held for observation about 2 weeks ago by the government.
Itong bakuna na ito ay tinigil para po maobserbahan ng mga 2 linggo noon.
Because there were very, very few cases of a severe reaction.
Ipinatigil ho ito ng gobyerno dahil may mga reaction sa katawan na grabe.
Basically, 1 in a million.
Pero isa lang ho ito sa 1 milyon.
But severe enough to make us pause and think of how we're going to approach this vaccine.
Pero ho ang reaksyon na ito na naidulot na kahit hindi ho madalas ay sapat na ho para itigil ang pagbabakuna para ho obserbahan pa siya ng mas mahabang panahon.
Because there were so very, very few cases, 1 in a million, the decision was made to release the vaccine with a warning.
At dahil kakaunti lang ho ang nagreporta nitong mga malulubhang epekto, isa sa 1 milyon, ay napagdesisyonan na rin nila ng gobyerno na ipagpatuloy ang pagbabakuna ng Johnson & Johnson.
The warning is that among women under 50,
at sa pagbabakuna nitong Johnson & Johnson ay may kasama hong warning or sa pag-iingat para sa mga babae na edad 50.
there is a very, very small risk
Merong maliit na tsansa
of a bleeding disorder
na magkasakit sa dugo or sa pagdurugo.
caused by the vaccine, but very, very small.
Sanhi nitong bakuna na to, ngunit ito ay napakaliit na persyento.
The symptoms of this disorder occurs about a week to 2 weeks after the vaccine is given.
Itong mga simptomas na ito ay mararamdaman mo ng mga posibleng 1 linggo hanggang 2 linggo pagkabakuna mo.
So it's very important for us as doctors to learn about this and know how to approach this problem.
Kaya napaka-importante para sa aming mga doktor napag-aralan ito para malaman ho ang impormasyon tungkol dito.
This reaction does not occur with the other two, with Pfizer or Moderna.
Wala kaming nahahanap na reaksyon na ganito dun sa bakunang Pfizer at Moderna.
Again, it's very rare but severe.
Inuulit ko, ito ay hindi madalas pero napakalubha.
So many women under the age of 50
Kaya madaming mga babae na mas bata sa edad na 50
should go ahead and if they want to choose one of the other two vaccines, Pfizer or Moderna,
ay pwedeng magpabakuna ng Pfizer o Moderna
if that makes them feel more comfortable.
kung ito ay mas komportable sa kanilang pag-iisip at
But again, it is a vaccine that's very useful.
pero
it is-
itong bakuna nito ay
it is-
napaka-epektibo at
It's
mabisa.
one dose,
Ito ay isang dosis lamang
and it's very convenient, especially if people cannot come for the second visit or have to be taken care of in their home.
at ito ay convenient para sa lahat lalo na kung nahihirapan kang magpabakuna.
Thank you.
Salamat.
Salamat. Salamat.
Thank you. And given the new information that we received around vaccines for children, are there any potential side effects that we don't know about that we should be looking out for children that are parents of children that are going to vaccinate their children?
At
Yeah.
dahil may mga bagong impormasyon na lumalabas dito sa bakuna, sa pagbabakuna sa mga bata, meron ho bang mga bagong impormasyon or simptomas na kailangan naming malaman para sa kung magpapabakuna kami ng mga bata?
There were several thousand children involved in the trials for this vaccine from ages 12 to 15, really.
Madaming mga bata ang napag-testingan para matry itong bakuna, mga higit sa mga 1,000.
The same steps that were taken last year for the first vaccines were taken for these vaccines, the same steps.
At ang parehas na proseso na ginamit namin nung unang nilabas ang bakuna ay siyang ginagamit pa rin namin ngayon.
And within this time, the vaccines were found to be safe and almost 100% effective in children.
At dito sa maikling panahon na to ay nalaman namin na itong bakuna na to ay 100% ding epektibo sa mga bata.
There were no side effects noticed outside of the ones we expected from the vaccine that we've already seen, like the bruising in the arm and a little pain. But there were no other side effects noticed in children that were different from the adults.
Wala naman kaming nakitang mga panibagong simptomas bukod dun sa nalalaman na natin na pananakit sa braso or sa pagpapasa ng lugar na pinag-injectionan.
But I'm a parent and I'm also a pediatrician, and I know what it feels like to take your child for vaccination. And even if you know it's safe, you worry a little bit about it.
Pero magulang din ako at alam ko ang pakiramdam ng dadalin mo ang iyong anak para magpabakuna at ang iyong pangangamba sa pag-i-injection nito sa iyong anak.
We take our children for vaccinations all the time, and we know that some of them have risks of side effects.
Dinadala natin ang mga anak natin para magpabakuna madalas at alam natin na itong mga bakuna na to ay may posibleng epekto sa kanila.
But the risk to the child and to the family of getting COVID is much greater than any risk that we can see right now with these vaccines.
Pero ang epektong masama nito ay hindi katulad sa benepisyong madadala nito sa katawan ng mga bata.
So from what we know now, the vaccines are good and safe. We don't know and there's nothing in them that lasts in the body for much time anyway.
Sa kung anong alam natin sa ngayon, ay itong mga bakuna na ito ay ligtas para sa mga bata at wala pa kaming alam na mga bagong simptomas na makakasama sa kanilang pangangatawan.
So I want to say one thing about how the vaccines work.
Gusto kong magsalita tungkol sa isang bagay kung paano gumagana itong mga bakuna.
And we'll talk about the Pfizer and Moderna vaccine.
At pag-uusapan natin ang Pfizer at Moderna vaccine.
Johnson & Johnson is similar, but based on different technology.
Ang Johnson & Johnson ay halos katulad pero gamit ang ibang klaseng teknolohiya.
And is not given to anybody under the age of 18.
At hindi ho ito pwede sa mga mas bata sa 18 anyos.
The vaccine, Johnson & Johnson, Moderna, what the vaccine does is bring a message, a copy of a protein that's on the COVID virus.
Ang Johnson & Johnson, I'm sorry, this is the interpreter. Did you say Johnson & Johnson or Moderna?
No, just Moderna and Pfizer. We're not talking about Johnson
Okay.
& Johnson. Let's talk about Pfizer because it's in children and the question was about children. We'll talk about
Okay.
Pfizer and Moderna is the same.
Okay, so go ahead. Just repeat what you said, I'm sorry.
The vaccine, the only thing the vaccine brings to your body is a copy of a protein that's on the COVID virus that creates infection. A copy of a protein.
Itong bakuna na to ng Pfizer at Moderna ay nagdadala ng kopya ng protein sa katawan. Hindi yung virus.
In a little envelope or a little, I'll say a little envelope of fat.
Sa isang parte ng taba.
There's no virus. There's no way you can get COVID. There's nothing alive or dead that goes into your vaccine.
Wala hong virus at hindi ho ito makakasanhi ng COVID.
Okay. Your body recognizes that copy, makes a little bit of the protein, and makes an antibody to the protein.
Ang iyong katawan ay makikilala itong protein na to para ho makagawa pa ng protein at ito ay makakapagprotekta.
And then your body gets rid of the protein immediately.
At yung protein na yon ay lumalabas din sa katawan.
So if you think about how this works, it's just teaching your body to react to the virus and protect you.
Kung pag-iisipan ho natin, ito ho ay tinuturuan ng ating katawan kung paano mag-react dun sa virus kung magkaroon man kayo nito.
So unlike other vaccines and other medications, there's nothing there that could possibly cause a long-term effect.
At hindi ho tulad ng mga ibang bakuna, wala ho doon na buhay or makakasanhi man ng COVID virus sa inyong katawan.
And this is what we know today because we base things on what we know today.
At ito ho ay base sa kaalaman natin nitong araw na ito.
Thank you.
Salamat.
Salam.
Thank you. And there's been a couple of questions from Facebook Live, and one of them is actually one of the questions in the chat as well. And that question is, for those who have already been vaccinated, could you tell us the latest word on boosters and what the rollout might look like in New York City?
Okay, sa may mga katanungan ho sa Facebook Live at pati na rin ho dito sa chat, at ito ho ay impormasyon ho tungkol sa mga nabakunahan na at sa posibleng pagbabakuna ulit sa booster sa kinakaharap.
Karagdagang bakuna. I'm sorry, ito ay karagdagang bakuna sa mga susunod pa.
Okay.
And this is a two-part question. It says, will we face the same urgency that we faced for our first shots or the original shots?
Okay, I certainly hope not. Boosters are an interesting proposition.
Ang karagdagang injection or karagdagan na bakuna sa COVID ay napaka
Interesante.
interesanteng
Mhm.
impormasyon ngayon.
To date, several of the companies are developing boosters in response to the variants or changes in the virus.
Sa ngayon, merong mga kumpanya, merong mga parmasya na gumagawa ng booster para sa bakunang ito.
Just like we give booster shots to our children for certain conditions, it may happen that maybe around the fall, we may need a booster.
So katulad lang din ng mga bakuna na ibinibigay natin sa ating mga anak na sa ibang kondisyon, maaaring ito ay maibigay pagdating ng fall.
In my experience with rollouts of vaccinations as a pediatrician, I know that once you get past the first stage, the boosters are easier to get. So I don't think we're going to we have the systems in place. We have things going already to get us vaccinated. So I don't think we're going to have the same difficulty. I hope not.
So sa tingin ko, base sa aking mga experience, sa aking karanasan, alam ko na ang pagbibigay ng booster o pagbibigay ng additional na bakuna ay hindi mahirap sa hinaharap. Ito ay nasa sistema na kasi.
Salamat.
Wala pong anuman. Salamat.
Salamat.
And there's another question from Facebook Live that says, it's kind of long, so I'll pause in the middle of the question. One recent headline is that the CDC no longer recommends that fully vaccinated people need to wear masks indoors or outdoors.
Isang headline ho ang lumabas na ang mga taong nagpabakuna na ng kompleto ng 2 dosis ay hindi na ho kailangan magsuot ng pangtakip sa mukha or ng face mask pagka nasa loob.
Isn't this recommendation dangerous, considering that fully vaccinated people can still become infected, and infected vaccinated people can transmit the virus to potentially unvaccinated people who may end up being hospitalized or dead?
Okay, so
Hold on.
that's a long question.
Yeah, do you want me to repeat it?
Second half.
Yeah, sure. Basically, is it dangerous to recommend that people not wear face masks anymore, given that people can still contract the virus that are unvaccinated and be hospitalized and die?
Di ba na parang itong rekomendasyon na to ay delikado para sa mga tao na maaaring magdala o magdulot ng pagkakahawa ng COVID-19 at maipasa ito sa mga taong hindi pa nagkakaroon o nakakapagpabakuna. Na maaaring sila ay maospital at magkaroon ng malalang karamdaman dulot ng COVID-19.
I think it's very understandable that we are still afraid. We have lived through a year of fear and worry. So when we're told to take off our masks, it's going to be anxiety provoking.
Na naiintindihan namin na nakakatakot pa rin kapag sinabihan kayo na tanggalin na ang inyong pangtakip sa mukha.
And yes, people that are fully vaccinated, if they are around people that are not vaccinated and they're symptomatic, they can contract the virus and give it to someone else.
At oo, kahit na ang mga taong kumpleto ang bakuna, kung sila ay may nararamdaman, ay pwede pa rin silang makahawa sa iba. Kung malapit sila sa mga taong hindi pa nababakunahan.
That is what we think. We're not sure. But
Yan
we
ang sinasabi namin na hindi pa kami sigurado.
But it has been determined that it is safe enough to remove your mask indoors and outdoors when you're with people that are fully vaccinated. That means 2 weeks after their last dose.
Pero base sa aming kaalaman ay kapag ikaw at ang iyong mga kasama ay kumpleto na sa kanilang bakuna at nakalipas na ng 2 linggo mula sa huling pag-i-injection nila ng bakuna, ay pwede na silang magtanggal ng takip sa muka sa loob ng bahay.
So it's prudent to wear a mask if you're around people that are unvaccinated, and it's prudent to wear a mask if you're out maybe in a theater or in a restaurant and you think you might pick something up that could infect someone else. It's a prudent thing, but not required.
Normal lang din na magsuot pa rin ng mask kapag alam mo na ang mga tao sa harap mo ay hindi pa nababakunahan, o kapag ikaw ay nasa publiko o sa lugar na may maraming tao at ikaw ay takot na kuha ng virus.
Yeah. We need to use personal judgment and comfort. If I feel uncomfortable, I will not go to a movie theater, but I will go into an open air restaurant and not wear a mask. I will be around my family without a mask.
Kailangan ho natin din pag-isipan ng ating ginagawa kung saan tayo komportable. Kung sa sinihan ay sarado at hindi ka komportable na tanggalin ng iyong mask, ay ito ay suotin. Ngunit posible na kapag ikaw ay nasa labas at sa mahangin na lugar, ay mas komportable kang tanggalin ng iyong takip sa mukha.
But I think the key message is the more people we have vaccinated, once we reach a critical number of people vaccinated, we will be much more secure. It's getting the vaccine that's important.
Pero ang pinaka-importanting mensahe sa ating lahat ay kapag lahat tayo ay nagpabakuna at marami na sa atin ang nagpabakuna, ay makakamit natin ang tamang rate para lahat tayo ay ligtas sa virus na ito.
I hope this helps with your concerns, and we should look to the New York State Department of Health for some of their regulations. They'll be coming out shortly in the next week or so.
Sana ito ay nakatulong sa inyong alalahanin at pagnubayan natin ang regulasyon na ilalabas ng New York Department of State.
Salamat.
Salamat.
I don't see any more questions, so I'm going to move to close the conversation. So thank you all so much for participating.
Thank you.
Thank you.
Maraming salamat sa inyong lahat sa paglahok.
Thank you so much to our presenters, and many thanks to the Endangered Language Alliance.
Salamat sa aming mga nagtanghal at maraming salamat sa Endangered Language Alliance at sa Red de Pueblos Translaciones.
And thank you so much for all your support from the interpreters, Abigail and Eden, this evening.
At salamat sa inyong mga suporta at sa mga nag-translate kay Abigail at Eden.
Are there any last minute words or comments from the interpreters, Abigail, Eden?
Sa mga kapwa natin mamamayan ng New York, dapat tayong sumunod sa mga panantunin ng bayan, mga protokol para makaiwas sa sakit na dulot ng COVID-19, magpalakas ng katawan at ibahagi ang mga impormasyon para makatulong sa pagpapabakuna. Salamat po at magandang gabi.
Salamat sa pagsali sa amin ngayong gabi at inaasahan kong nabigyan namin kayo ng mahalagang impormasyon na magagamit nyo. Naway ikaw at iyong mga pamilya ay manatiling ligtas at malusog sa oras ng pagsubok na ito.
Okay. Thank you all so much, and I hope you all have a great rest of your night.
You too. Thank you. Bye-bye.
Magandang
Thank you, everyone. Good night.
Magandang gabi. Good night.
Bye-bye.